Hi there, my name is Dr. Cary Yurkiw. I founded True North Practice Management to help doctors and therapists like you, people who want to do better in practice but are struggling with challenges. And one of the things I wanted to talk about today is burnout and stress in private practice. And this is very common, especially in the last couple of years, where doctors and therapists are feeling a lot of pressure and a lot of stress. And so today I wanted to address that issue. And it's part of the research I'm doing to do a second edition of this book called Successful Private Practice. So in this book, I talked about what it takes to be successful in private practice. And I've practiced now for 29 years. Next year will be my 30th. And I've learned a lot along the way from other doctors, from different clinic situations and scenarios. I've had a lot of clients over the years that I've learned a lot from them too. So I've worked with and in over 50 offices that are multidisciplinary, and it's been a great experience. And now I want to continue to give back by writing a second edition to the book. And we are taking on some new clients now for True North to help doctors and therapists that want to get back on track. So let's go over what some common causes of burnout are. I was reading an article, and I'll share that in the link below, in the show notes below, talking about what causes burnouts in physicians. And I was relating that to private practice. And I think, what's important is to connect to that, to what causes that for doctors and therapists that are in private practice. So here are 5 reasons that doctors and therapists feel burned out. Number 1 is working with patients. So maybe coming out of college or in private practice, you have certain expectations of what the patient care is going to be like, what the outcomes are going to be like, what the clients will be like. And if that's different than what your expectations were, then you can lose focus. You can lose kind of that dream of what your practice was going to be like and the difference you were going to make in people's lives. A lot of us as doctors and therapists want to make a difference. We want to change lives and save lives, depending on the type of profession you're in. Number 2 is paperwork. So a lot of doctors and therapists hate doing paperwork, and it's kind of a drag because it takes them away from seeing patients. It's necessary, it's very important to document the visits, but maybe they don't want to delegate that to a staff member or use technology for that because they have to learn a new technology, or maybe they don't trust their staff to do as good of a job as they do. And so they could be, a perfectionist that really doesn't want to delegate. So doing too much paperwork and kind of not doing the things that you love to do can start to feel tedious, and over time the stress can build and then start to feel burned out. The work-life balance. So working long hours, long shifts, multiple days in a row, and it starts to affect the work-life balance, and you're no longer doing the things that you love to do. So you're not doing, hobbies or athletic, going for runs or biking or swimming or whatever you like to do. So your work-life balance is off, and you don't have time for some of the relationships that you really value. So that can change. How you feel about practice and how you're doing in your profession. The business of private practice. No one really taught us how to do the business side. And unless you have family members or advisors that can help you with the business side, we come out of school as experts in treating patients, but we're not good at the business side. And it can take time to develop those skills. Sometimes you learn from a lot of mistakes, but that can be really stressful. And then the last thing is finances. A lot of doctors and therapists come out of school with a lot of debt. That in combination with just living in your lifestyle can put a lot of strain on your finances. And so it's very important to have a good handle on your finances, have a plan to reduce and eliminate debt, and to work towards prosperity. So speaking about that, what we do here at True North is I help doctors and therapists to find their passion, to get back to why they became a doctor or therapist in the first place. And the goal is to refocus, to put some systems in place to help doctors and therapists to grow their practice and to manage that growth, to delegate tasks to staff, hire the right staff people and manage them, and then grow your business. The ultimate goal for my clients is I want to see them happier, healthier, and wealthier in the time that we work with our clients. So initially we'll start with a 3-month term or sometimes a 6-month term, identifying what the factors are that have led to the stress or the burnout, or what's interfering with the doctor or therapist achieving their goals in practice. And then what we get into is, ways to overcome that, looking at the big picture, refocusing on some of the goals and dreams, getting the doctor or therapist to dream a little bit bigger and start to expand that vision, and then eventually to achieve those metrics that they set out for themselves. So that's the goal here at True North. We use a number of different methods that I've learned over the years working with different health professionals, and everybody's different. So one of the things I like about True North and the coaching style is it's not predetermined or preset way of doing things. It's customized for our clients and their personality type, their situation. Everybody's different, so it's important that we match that coaching style with their situation. If you're interested in the book, I'm going to put a link in the show notes below, but I also would like your comments on today's topic and burnout and what's causing burnout for you, what you want to accomplish in your practice in the next 12 months. What are some of the obstacles you're facing? So, and what you would like to see in the next edition of this book. If you're interested in a free 20-minute consultation, we are offering that right now. I do all the coaching here at True North, but you can click on the link below or in our bio, and then you can get a 20-minute free consultation where we can talk about your stressors, your obstacles to achieving growth, and then what your dreams and goals are for the next 12 months. The last thing is follow us here on YouTube and in our podcast on Spotify and Apple iTunes. It's in the Google Play Store as well. And subscribe to our channels, and then follow us here on social media, because as I do this research for the book and I'm sharing the research with you, I do want your feedback, and I do want to get to the point where I can kind of modify the content from the first book, refocus it on taking the doctor or therapist from where they're at to where they want to be. And I'm really interested in improving the book and improving the audiobook version of it. So I'm all ears as far as your feedback goes. You can comment below or DM me. I'd be happy to hear from you. And I look forward to talking to you guys again tomorrow. Have a wonderful day, and talk to you soon.